It is really unconscionable that almost 20 years after the passage of the Americans with Disabilities Act, that 2 of the 4 goals of the ADA, the Americans with Disabilities Act, 2 of the 4 goals are still not realized. Economic self-sufficiency and independent living. Under present law today, if you are a person with a disability and you qualify for institutional care, Medicaid must pay for your institutional care. If, however, you'd rather live in your own home, Kelly, or live in the community and have just some modicum of support services, Medicaid does not have to pay for that. And so it's left a lot of people with disabilities who want to live independently sort of in a never-never land.
The idea of the Class Act is very simple, that those who are planning responsibly for their future and looking forward to years ahead with disability could start to pay voluntarily and self-fund a premium for an insurance policy that after certain years would give you or the recipient and beneficiary a cash benefit which would allow independence, flexibility, self-esteem, continued work.
This is a voluntary, national voluntary insurance program that helps people with functional impairments access the services and supports that allow them to continue to live their daily lives. The amount of the benefit would depend on the degree of disability, but it would be no less than $50 a day. It can pay for aids like a shower chair or wheelchair ramp, providing for a caregiver, people bring meals, a driver, and a car that could take people back and forth to their work place or other such needs they may have.
It is about independence. Whether or not someone who has so much to contribute by their brain power and their education and their commitment to achievement and to participating in the workforce, whether or not that person can do that, whether or not we're going to give them a little bit of help, just a little bit of help by creating a vehicle or a pathway, whether they're going to be given the chance to be independent.
Not a nickel of taxpayer money, not one nickel, not one penny of taxpayer money goes into this program to pay for benefits. In fact, we have added new language to assure this for some colleagues who had doubts about our commitment to this. Over 275 organizations have endorsed the Class Act, groups representing seniors, individuals with disabilities, women's groups, religious groups. I know of no other provision in our bill, the overall health care bill, that has enjoyed such broad-based and deep support from as many different diverse organizations.
There are tons of women just like me who are taking care of their mothers, their fathers, their aunts. We're all doing it. The Class Act will help us do it right. It's time for our country to realize that the caregivers' problems don't exist because we don't care. They exist because our policies don't help us enough to do what we need to do.
I'm a personal care assistant, and I love what I do. There are thousands of personal care workers in the state of Virginia who continue to work on behalf of those who need it most, improving their quality of life and strengthening their communities. And then there are millions in America affected and in need of long-term home care programs, and this legislation gives millions of Americans an effective and affordable choice of home health care for their loved ones or themselves.
This really is reform that is designed to make real the promise of the Americans with Disabilities Act to help people with disabilities remain in their own home and lead independent and autonomous lives.
It's a very simple, cost-effective, and very practical step that can take to make long-term care more available and affordable to so many of our fellow citizens in this country. It'll allow millions of Americans to maintain their dignity. And I don't know how you put a price on this, but the idea that people can live with dignity has great value in my book. And while I can't put a dollar amount on it for you, I can tell it's priceless in many ways to be able to have that opportunity to live your own life independently without having to depend on anyone else, because you've contributed very directly to this long-term security plan.
I really encourage all of you and your colleagues to continue thinking about long-term care and to think about how you're making it easy for people to prepare for something that we're all going to face. And for me, as a person with a disability, I'm 41. I could pay into the Class Act for 30 more years and continue to do the legal advocacy that I love.